for coming into this workshop. I look forward to sharing with you all, and look forward to this workshop being of some value to you. Let me start also by saying that in the chat, if you have the chat open, I put something in the chat. I put my contact information in the chat. I also placed several documents in the chat as well. The bibliography that I am citing, books that I'm citing from, I placed in the chat. I placed a definition of racism in the chat, and if any of you can print it, it would be great because you could have it right with you to see it at some point when I am defining racism. And also, I put an article that I did find on decolonizing healthcare as well. I thought it was a pretty good article, and so I did post that in the chat.
It isn't showing up. It isn't showing up.
All right, well, maybe the host can help somehow. I mean, hostess can help somehow with that. And but at any rate, it's there. And so I'm going to go ahead and get started, and maybe near the end of the presentation, if we have time, I can send them again and see whether or not we can make that happen. So my name is Heru-Ka, and let me do this first because I can pretty much talk over who I am, and what I want to do is share my screen. And let's see if this works. And if I can do. So can folks see my presentation?
Yes.
Yes.
Okay, perfect. All right. So let me tell you a little bit about who I am. My name is Heru-Ka. I am a peer wellness specialist, cultural therapist, a racism therapist, certified recovery mentor. And I came to doing this presentation to an extent from the work that I've been doing for years in addressing racism, toward the work to end white racism, and also cultural therapy, the work that I do towards restoring the African identity to Black people. So that's my work. And then with respect to um, being a peer, I come to this conference by way of wanting to address something that was absent in the training that I did, but I think really is germane to peer health and wellness, as well as to our health and wellness across the board. One of the things that I realized in doing the peer work was the absence of a core part of the curriculum being on racism and its impact on health. And so, for example, like in the course where I had the opportunity of doing the ACEs test, based on the ACEs test, my score was very low because the ACEs test had more to do with family trauma than it had to do with, for example, trauma that came outside of my family. So for example, use of drugs and mental health issues didn't come anywhere from family. It came from the society that I was a part of, a very racist society that impacted me as it impacts many people of African descent in extremely negative ways, that sends us into the world of drugs and also creates mental problems for us. So, this is how I come here. I did back in probably 2000, 20 years ago. Um, I used to, even before then, I was doing a radio program. I'm from Baltimore originally, and I was doing I was a host of a literary review program. And there was a psychiatrist with the Maryland VA who called me and invited me to keynote at his annual conference on racism. And I'm bringing him up because I want to thank him. Um, we met before the conference. So went to his office, we sat down and we met and we discussed our understanding of racism. And one of the things he said to me was, he said, Heru, he said, with every one of my, particularly African-American clients that come into my office, I let them know no matter what issues they are dealing with, that their issues, the root cause to their issue is white racism. And this is a white Jewish guy who shared this with me. And he said, there are two things that I put in their hands. I give them a copy of the book, The Psychopathic Racial Personality by Dr. Bobby Wright, and I give them a copy of the ISIS Papers by Dr. Francis Welsing. And, so we talked about the significance of that, the impact of racism uh, and how broad it is in the life of our people and its tremendous impact in generating mental illness in our community. So um, I'll say a little bit more about that as I go on, because otherwise I'll get to talking and it'll be over a bit before I get to the next slide. So I'm going to go on into the presentation. I want to thank him. And the thing is, I don't even recall the man's name, and I really wanted to say that. So I'm with with Ankh Holistic Life Center, and we provide African-American cultural and mental health. So as I shared in the beginning, we offer cultural therapy, racism therapy, peer services, education, consulting, and I'm located here in Portland, Oregon. So that's me. I want to talk about racism, and what I find is that we hear about racism quite often in our conversations when we're addressing mental health and when we're talking about addressing injustice in the society in which we live. But one of the things that I find is that many of us use the term racism without fully understanding what racism is. So I figured, let me address this, not only in talking about racism in terms of definition, but where does racism come from? And so the best definition of racism that I've come across is that by the noted anthropologist, historian, scholar, Dr. Cheikh Anta Diop. And Diop, particularly in his book, Cultural Unity of Black Africa, that book was actually published in French, but I can't pronounce the French title since I don't speak French. But it was subsequently published in English as the Cultural Unity of Black Africa. And from that was discerned what is known as Diop's true cradle theory. And what Diop offered in terms of his theory is that the two primary races uh, um, were engendered in two different environments. So he identified Africa as the southern cradle. And he said Africa in the southern cradle produced a human being, black in skin color, in an environment that was abundant of resources, that in the way of life, the people became semi-sedentary. That's mainly through animal herding, and sedentary through agriculture, that the family structure was matriarchal, primarily, and matrilineal descent through the woman. And the society was xenophilic, tolerance and love of strangers. The climate was warm and hospitable, and the psychocultural orientation of the people was collectivist. In contrast with the Euro-Asian environment, he pointed out that this environment generated a person who was white in complexion, that is, lacking the degree of melanin that the African had, and that in this environment, the environment was scarce in resources. The people were nomadic, principally hunters. The family orientation was patriarchal, male dominant. That the the society was xenophobic, in other words, not tolerant of strangers. The environment was cold and hospitable, and that the society, the philosophical orientation was individualistic. And so Diop points out that with these two um, societies, that they were diametrically opposite. So the northern cradle and the southern cradle, where you had one scarcity of resources, the other abundant in resources, that when these two societies met, they clashed. And it is through this clash that engendered racism. And so the point being made here is that when we talk about, and I'm going to use the term black and white, black people and white people, there's a cultural difference. I mean, beyond just simply the phenotypical appearance that we have, there actually is a psychocultural difference to us based on the environments in which we came into being. And so that clash that occurred still persists. The definition of racism, coming out of that particular clash, racism is the act of one race imposing its totality, itself, upon another race while denying the victimized race its totality. So as I have here, it's imposing its culture, history, philosophy, politics, values, its being upon another race to dominate and exploit while denying the victimized race its humanity. And that by definition, racism is an act of violence. Racism is maintained through violent action. Racism is group behavior, and that individual acts are an extension of and supported by group domination. So for example, an individual act would be, was it Karen up in New York, who was at the Central Park, walking her dog not on a leash, and the young man, African American, confronts her about it and asks her to put a dog on a leash, and she threatens him by, with calling the police on him. So the individual act is supported by violence. She know that she could call police and have violence on him. So let me go back to the first this slide here. So if you will, the you have to the left the white circle and the black circle representing the two different races. White circle representing white people, the one to the right, black representing black people. And so what racism is, as I pointed out, the imposition of one race upon another. And that is the white race, if you will, imposing itself upon the black race and negating the black race. So in this negation, you have a negation of the humanity of black people, so that racism, white racism, actually is a form of total domination. It defines the victim as non-human, pretty much non-existent. It's like a piece of furniture. They just simply do not exist except when you define that they exist, and they are what you want them to be. So there's no humanity in this relationship. Also, I'm hitting buttons. Bear in mind that what I'm addressing is, well, I simply want us to get a great definition of this. Diop's two-cradle theory is a seminal work, and one of the scholars who has done an excellent work in addressing the origin of racism is Dr. Vulalila Wobogo. And Wobogo's book entitled Cold Wind from the North, The Prehistoric European Origin of Racism explains by Diop's two-cradle theory. This is this one is a 600-page work on Diop's two-cradle theories on the origin of racism. It's an excellent work. And so let me also just let you know that because I have so much information to share, I'm also citing books for you so that you can simply consult. with that. And here the a definition of racism: the persistent systemic and pervasive acts of aggression by white and yellow peoples against black people from about 20,000 BC through the beginning of the Christian era resulted in the conquest, expulsion, and extermination of the blacks and the concomitant usurpation of their territories, formed systems of white and yellow supremacy, the goals of which were the establishment, maintenance, expansion, and refinement of domination by the non-blacks over the blacks and the territories they once occupied. So again, racism defined is the act of one race through violence, imposing its totality upon the victimized race while denying the totality of the victimized race, that it is an act of violence. So when we think of racism, oftentimes I hear people thinking that it's something like prejudice or discrimination, but racism is a hell of a lot more than that. It actually is the violence of another race. So when we talk about racism in this country, in the backdrop and in the background of that is white military. It is white police. It is white force. So it is not just simply something that just simply sits in people's minds that say, oh, I don't like black people. It's much, much more than that. And then colonization. Colonization is the state of being dominated and controlled by another people in all spheres of existence: political, cultural, economic, and social. It is the control of one's resources, means of production, labor, and action by the dominated group to the benefit of the colonizer, that is the dominator. So for example, and one of the things that we hear is, you know, black people were supposedly freed from chattel slavery, 1865, more than 150 years ago. And so the illusion that we that is propounded and pushed upon us is this idea that we're somehow free. But colonization is actually a state of unfreedom. So when we look at the definition of colonization, and that is the state of being dominated and controlled by another people in all spheres of existence, political, cultural, economic, and social, we can see that anybody that wants to contest that, we can't name one city, one state, one community, one place where black people exist in North America that where they control their politics, the culture, economy, and social apparatus within the community that they occupy. We are, in fact, a people who are a colonized people. So one writer asked a question: though political colonialism supposedly ended with the political independence of mostly African nation states that were under colonial rule, coloniality, a basic ontological, epistemological, and cultural logic of power that emerges as part of colonialism remains and persists under present-day neoliberal configurations of capital and governance. Coloniality dominates institutions that shape the day-to-day relations of our very existence. Just emphasizing the point that we African people in this country are a colonized people. This is a new book, Africanity and Ubuntu as Decolonizing Discourse. So I'm just citing literature also, as I said, so that you can have references to consult. I pulled this from a Rupa Murya article online. If you look up that name, you'll find a really nice article on colonialism. So she had a chart there that I figured I could use. So I pulled this chart to share with you. And so what it does is it highlights colonialism, colonization, and attendant elements to it: supremacy and capitalism, two of the predominant features of it. And so in the left column of supremacy, we see here that white racism is listed because this is an advocacy that we hear and that we are confronted with. White supremacy, the war for white supremacy. As I share with people when we talk about white racism is the tool. White racism is the act of violence. It is the imposition. White supremacy is the goal. And that is white folks engage in the action, the violence of white supremacy to establish, the acts of and the violence of white racism to achieve white supremacy. The driver behind it is the white agenda. So the white agenda would be the remote control, White racism would be the act, the goal being white supremacy. And under that, there's male supremacy, as I indicated earlier, that the society is a patriarchal society. White people argue that they are the supreme human being on the planet. And out of this behavior and practice of white people came slavery for cheap labor. I'll get into that later. Genocide, invisible labor, femicide, child abuse, ecocide, exploitation of resources, and of course, leading to trauma. So if I 2 years ago at Peer Apocalypse did a piece on trauma, racism pathology, challenges and peer support, bringing it up that this is something that we must address. Anytime that we're dealing with Black people, a Black person, trauma, racism trauma is a factor. That when we look at colonization and we bring this into the question of decolonizing African American healthcare, and one may ask, well, what does that mean? I mean, like, are we colonized, and what would be the indicators for that? An excellent book is Medical Apartheid, and Medical Apartheid, published by, written and by Harriet Washington. I'll just read you what it says here. The product of years of prodigious research into medical journals and experimental reports, long undisturbed, Medical Apartheid reveals the hidden underbelly of scientific research and makes possible for the first time an understanding of the roots of African American health deficit. At last, it provides the fullest possible context of comprehending the behavioral fallout that has caused African Americans to view researchers and indeed the whole medical establishment with such deep trust. From the era of slavery to the present day, starting with the earliest encounters between Africans, that is Blacks and white Western medical researchers, and the racist pseudoscience that resulted, Medical Apartheid details the way both enslaved and freedmen, Black people, were used in hospitals for experiments conducted without their knowledge, a tradition that continues today, which also impacts how we think about COVID-19. How we think about any medication that is promulgated to us or put to us by white people is one of the difficulties, because you'll hear in every Black community that part of the reason that some Black people will not seek COVID-19 vaccination has to do with medical apartheid, having to do with the history of racism that is constant, has been a constant. And so the going back to the definition of racism and the definition of colonialism being the total control, white people have had total control of our medical health care. And that colonization of African American healthcare is an extension of the colonization of African American people. So the content and scope of African American healthcare is defined by white people from a white paradigm, including its perspective, scope, goal, and objectives. So when we consider African American healthcare, all aspects are dominated by white people, including the definition. So let me go back here. Well, as this author here points out, when we talk about medical apartheid and the treatment of Black people, this book here, Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare, the author points out, at no time in the history of the United States has the health status of minority populations, African Americans, Native Americans, Hispanics, and several Asian subgroups equal or even approximated that of white Americans. In 1995, the overall African American mortality rate was 60% higher than that of whites, precisely what it had been in 1950. So can you imagine that? 1995, our mortality rate 60% higher than that of whites, right? And it hadn't changed in 50 years. So when we ask this question, when we are having these dialogues about African American healthcare in North America, in so-called the richest society, the leading society in healthcare, the question, it should lead to questions. Why? Why is this such a disparity? And the point that I'm making over and over is that of racism and colonialism and the intent of racism and colonialism towards it. This is intentional. The author, Wade Nobles, He writes, Western social science should be viewed as the creation and reflection of European Western man, and his particular self-defined practice of Western social science as predetermined by the particular way in which it develops. I mean, its developers, Western man, understood and were conscious of their own awareness of reality. That is, Western social science was molded after and reflects the Euro-American conscious understanding of his own consciousness. In other words, that the Western medical tradition was created based on white people looking at themselves and defining it based on themselves being the norm, and in context, in the context of white racism and colonialism, no consideration for Black people at all. So that the author here says contemporary Black people in the United States live in a psychosocial reality consistent to and supportive of white mental function. Such a situation is tantamount to Black people living in white insanity. The implication of this is clear. The Black mental health professional must accept the challenge to seek out the causes of Black mental illness and define Black mental health. The search for a cure for Black mental illness will lead us to the position of requiring the eradication and metamorphosis of the fundamental premises upon which white American society is based. Because white American definitions of mental health, white American establishment, health establishment is all centered around the white psyche, what it is, what is for white people, with Black people not being considered at all. So as Wade Noble says, the latter part of his statement, that the search for a cure for Black mental illness will lead us to the position of requiring the eradication and metamorphosis of the fundamental premise upon which white American society is based. In other words, there's a need for Black people to dethrone the white paradigm, because the white paradigm, apparently, as I have shared already, has not served Black people. So when we look at medical apartheid and other literature, Black healthcare is dominated by the white healthcare industry and infrastructure within the context of white racism begs the question. Can African Black people actually receive and experience true comprehensive healthcare in a white racist colonial dominated milieu? So talk a little bit about this disparity. So colonial healthcare, which defines the African American dynamic, is about profiting the white healthcare exploitation industry. In every area where African American healthcare is abysmal, white profitability is high. So imagine that. And everywhere where it is, our healthcare is just in the dumps, white profitability off of that given area is very high. So, to understand the correlation. So from the publication entitled Unequal Treatment, the writer says, at no time in the history of the United States has the health status of minority populations, African Americans, Native Americans, and more recently Hispanics and several Asian subgroups equaled or even approximated that of white Americans. The health of all American racial and ethnic groups has improved dramatically, particularly over the last 6 decades, but the paired burdens of excess morbidity and decreased life expectancy for people of color has been noted over several centuries and have proved even recently to be stubbornly resistant to substantial change. Points out, he says, there are two observations some 4 decades apart, illustrate the persistence of inequality. In his classic 1944 study of the role of race in America, in American life, Gunnar Myrdal noted that area for area, class for class, Negroes cannot get the same advantages in the way of prevention and cure of diseases that whites can. This is 1944. In 1985, the report of the Secretary's Task Force on Black and Minority Health concluded that despite the unprecedented explosion in scientific knowledge and the phenomenal capacity of medicine to diagnose, treat, and cure disease, Blacks, Hispanics, Native Americans, and those of Asian Pacific Islanders heritage have not benefited fully or equitably. The writer goes on to say, in 1995, the overall African-American mortality rate was 60% higher than that of whites, precisely what it had been in 1950. Now, the thing is that what I've just shared with you just in literature is over 100 years of observation that African American Black health, so-called health in this country has not changed. It hasn't moved. Actually, it has gone, it has stayed as bad as it is if our health was during the period of enslavement. From the same publication, another author writes, racial and ethnic minorities tend to receive a lower quality of health care than non-minorities, even when access related factors such as patient insurance status and income are controlled. The author says the sources of these disparities are complex and rooted in historic and contemporary inequities and involve many participants at several levels. So as I go on and I read down further in this particular work, what I realize is the author is saying that white racism is endemic within the medical healthcare system at every level. And I mean absolutely every level, from the time that the Black patient walks through the door. The author says, including health systems, their administrative and bureaucratic processes, utilization managers, healthcare professionals, and patients. Consistent with the charges, the study committee focused on part of its analysis on the clinical encounters itself, and found evidence that stereotyping, biases, and uncertainty on the part of the healthcare providers can all contribute to unequal treatment. The condition in which many clinical encounters take place, characterized by high time pressure, cognitive complexity, and pressure for cost containment, may enhance the likelihood that these processes will result in care poorly matched to minority patient needs. So just as he goes on, it just makes it clear that it's no particular group of doctors. There's no particular process. It is a collective process. That racism is a collective enterprise in the medical industry. So a key question is, in light of the history of white racism and its impediment to improvements in African American Black healthcare, is the outcome intentional? So from the perspective of profit via the medical industry, the answer is yes. So here, the author says, at no time in the history of the United States is the health status of African Americans and Native Americans. So I did read this before from Unequal Treatment, right? So in this particular publication here, the author writes, the USA is ranked 49th in the world for male and female life expectancy. This is due to what is happening in the U.S. healthcare system and not other actions that affect life expectancy. This, in large part, is due to overdiagnosis of symptom-free individuals and overdiagnosis also for those with medical conditions. So the author is saying here in this particular work from the research that the life expectancy of, and this is everybody, white, Hispanic, Asian, no matter who you are in this country, the life expectancy has decreased because of the machinations of the healthcare industry. It goes on to say, overdiagnosis occurs when symptom-free individuals are diagnosed as having conditions purported to require treatment through conditions that would never cause symptoms or death. These overdiagnosed individuals are receiving no benefits. They can only be harmed by the drugs usually being prescribed. Curbing these practices would save hundreds of billions of dollars annually and yield a considerable health benefit, particularly if symptom-free individuals receive scientifically sound advice regarding what constitutes a health producing lifestyle. So when we talk about, for example, symptom-free, people think of the opioid drug crisis in this country right now, and how many people who didn't need it were prescribed it anyway. And there is overdose also for those with medical conditions. The author continued, in this instance, it takes place by treating normal, ordinary behavioral and feelings as mental disorders and thus medicalizing them. One way this happens is by expanding criteria for various categories of mental disorders featured in deceptive drug ads. As examples of this kind of diagnostic inflation, note these incredible increases in the diagnosis of the following mental disorders in the span of 15 years. Childhood bipolar disorder prescriptions, 40-fold. Autism, 20-fold, a tripling of attention deficit hyperactive disorder, a doubling of adult bipolar disorder. These instances of overdiagnosing and medicalizing normal behavior can only occur when the criteria for these disorders are not followed. Excuse me. Clearly, diagnostic inflation has to be widespread and out of control when studies report very high prevalence rates for mental illness in the US, like this one. A study claiming that 80% of adults at age 21 meet the criteria for a mental disorder. This is pharmaceutical and medical industry gone wow. All right. And this is just everybody in the country, including Black people, but it's everybody in the country, right? Now, in relationship to African people, people of African descent, how are we affected? So Arthur Clovis Sims, in his book, Racism, Health, and Post-Industrialism, A Theory on African American Health, had this to say. Social iatrogenesis occurs when health is undermined by social organization of medical care. Here, the radical tendencies of the medical industrial complex to control and expand medical markets independently of the goal of health are an example. Disease is characteristically socially constructed, but medical monopolies continually expand the boundaries of morbidity and impose their considerable power of social control to seduce and coerce the citizenry to consume their products. So iatrogenesis is actually where the medical industry creates the illness, creates the condition, and feeds off of that condition. So, for example, an example of iatrogenesis would be medical iatrogenesis in the Black community would be diabetes. It would be hypertension. So the pharmaceutical industry, in collaboration with other industries that wish to profit off of Black people, for example, the industry that produces sugar. We know that you go into stores and sugar is everywhere. And we know that sugar is a major addictive drug. Slash food, but drug. That salt is a very addictive and harmful drug used in large quantities, and yet the food industry pushes these drugs in Black communities very hard, leading to diabetes, leading to hypertension, and we know across the medical industry how to address this. But rather than invest in reducing, they actually invest in creating and pushing it, iatrogenesis. And so the author continues, he says, cultural iatrogenesis is the process of transforming people into consumers by destroying their ability to deal with pain, sickness, and death. It destroys the capacity for self-care. The tendency is to make people lose their ability to generate a countervailing struggle against counterproductive medical expansion. So this expansion in the industry of turning everything into an illness and everything into a sickness is even more prevalent in the Black community that has less resources, no institutions, no medical industry, no real way to fight this. So the answer is yes. In essence, African Americans are like penned cattle to be economically fed upon. In other words, wherever you find large Black populations, that is like East Coast, West Coast, where you have the larger Black populations, you find a large medical establishment. So Black communities are like cattle pens, and you have medical establishments and other businesses that actually feed off us like cattle based on this medical industry. And so in the definition that I sent to you, I point out that racism, white racism, is parasitic, in that it feeds upon the vulnerability, including helplessness of its victims, upon their production, upon the cultural product, upon the intellectual product. It is parasitic. And so Black healthcare is dominated by the white healthcare industry and infrastructure within the context of white racism begs the question: can African Black people actually receive and experience true comprehensive health care in a white racist colonial dominated milieu? And we just looked at 100 years, more than 100 years of no change. So therefore the question we must ask and so we know that what is happening to us is intentional. We must ask the question, what must and can we do to address the African Black healthcare situation? All right, so one of the things that comes up in the conversation is health equity. Health equity is defined as the assurance of the conditions for optimal health for all people and must be present to eliminate health disparities. I'll say that again. Health equity is defined as the assurance of the conditions for optimal health for all people and must be present to eliminate health conditions. However, this is me saying this. However, this definition defines health equity as happening within the context of white domination, which of course is an obvious oxymoron. So on the one hand, you have the domination that's designed to exploit and feed off of you in an unhealthy state, while we are now talking about health equity. These are two opposing forces in the healthcare industry as it relates to Black people. So one of the things I want to go, well, let me just point the book out here. Colonial Status of African Americans Within the Medical System has now been documented in a variety of ways. According to the classic definition of Frantz Fanon, a revered psychologist in the field of medicine, of psychiatry, and particularly as it relates to African people under colonialism and racism. Uh, um, Sorry, I got off of this. According to the classic definition of Frantz Fanon, colonial medicine is based on the estrangement of the dominated population from the medical personnel of the dominant authorities who regard colonial subjects as less entitled to humane treatment. That is why their pain is documented as unimportant. So all of us, I'm sure, have some story about I went to the doctors, if you're Black, went to the doctors, told the doctor I had pain, doctor told me, well, go home and sleep it off, because I just had that experience in the last year, that very same damn thing. All right, but anyway, so this is an excellent book to get, Black and Blue, The Origins and Consequences of Medical Racism. So one of the things that I think I would like to do is to go back and look at what Dr. Wade Noble says. He said, contemporary Black people in the United States live in a psychosocial reality consistent to and supportive of white mental function. Such a situation is tantamount to Black people living in white insanity. So in other words, the conditions of the suppression of white people's totality, white people's culture, their philosophy, their beliefs, their total being imposed on Black people basically creates a caricature, forces Black people into a caricature to become a caricature of white people, hence the mask. And hence the book by Frantz Fanon that you all should read if you really want to deal with, in the quest to deal with addressing Black mental illness, Black Skins, White Mask. By him. So I want to talk about the white insanity. What is the white insanity? Dr. Bobby Wright calls it the psychopathic racial personality. Dr. Marimba Ani in her book, Heru-Ka, calls it Heru-Ka, responsible for disorder in the universe. Dr. Frederick Hickling out of Jamaica calls it European American delusional psychosis, that where European Americans proclaim ownership of the world. And then Heru-Ka call it conquest pathology, the compulsion to conquer and dominate every aspect of creation. So I'm going to say some more about it. So the book, The Psychopathic Racial Personality, you should read it. Dr. Bobby Wright contends Black people are not the problem, that it is the white racist psychopath that needs to be put under the microscope and studied, for he is the race and world problem. If Black people are to be understood, if Black people are to understand and resolve the problem of racism, it will be with understanding and neutralizing the white psychopathic racial personality. It's an excellent book to deal with, because what he says is, if that racism is a problem that actually comes from white people, then it's not Black people that needs to be studied mentally, it's the problem. In other words, you want to deal with the cause of the problem. Heru-Ka, the threatening of the well-being of humanity. Dr. Marimba Ani, in her work, defines Heru-Ka, a being in Dogon mythology. The Dogon are an ethnic group in West Africa, very ancient, a very old group of people in West Africa, defines Urugu being a Dogon mythology which is responsible for disorder in the universe. This is a being conceived in denial of the natural order, which then acts to initiate and promote disharmony in the universe. In African cosmology, such a being is deficient in spirituality, spiritual sensibility, and is perpetually in conflict, is limited cognitively, and is threatening to the well-being of humanity. The European American psychosis of collective delusion. So Dr. Frederick Hickling expresses it this way. The principal finding is the recognition that Eurocentric concepts of white supremacy, which identify European ownership of the world and the people and the resources therein by divine right, were elements of a collective delusion that has attempted to enslave the world since the 15th century. This collective psychopathology has been called the European American psychosis. Now, I kind of want to rest here for just one moment and look at this, the collective delusion. And that is a people who set out to own the world, so that when we go back and we look at the 15th century Europe, Columbus and other pirates who were setting out to take something from somebody else, goes before the Catholic Church to the Pope of the Catholic Church, who issues a papal bull and says, you, to the Portuguese, can have one side of the world, you to the east, and then the other to the west. So everything in the world, as if the world belonged to the Catholic Church, as if the world belonged to white people. This collective delusion. And white people did go out from this edict to conquer the world. So Dr. Dr. Hickling says, the major insight emerging from the psychohistorographic analysis is the concept of the European American psychosis. Columbus, Cortez, and Cook manifest clear delusional beliefs and psychotic hallucination that shaped the entry of Europe into the New World. The question to be answered is how vast populations of European people collectively bought into reality the lunacy of genocide and the delusional atrocity of racism, slavery, and centuries of imperial oppression and greed. So he asked the question, how did masses of white people buy into this collective delusion? And my answer is conquest pathology. So conquest pathology, endemic to Euro-Asian culture, the driving impetus of white racism is the compulsion to conquer and dominate every aspect of creation, everything within existence, real and imaginary. Conquest pathology manifests as ecocide. So when I shared, and I ended up in a very limited debate with some scholars over racism and trying to understand white people, and I made the argument, I said, actually, you can't understand white people by studying racism. You can get some aspect of it, but actually, racism doesn't explain why white people kill trees, why white people will destroy a forest, why white people will literally kill a particular animal or species into an extinction, while white people will mine a given area for all of its resources, and while doing so, destroy the area around it. Racism doesn't do that. And that conquest pathology is actually older than racism, and conquest pathology explains racism. It preceded racism. It actually helps us to understand the white psychology. So conquest pathology also manifests as white racism. The actions of violence, and going out into the world and imposing oneself on the world to conquer and own and control the world. And it manifests as capitalism. The economic system and philosophy designed to exploit the labor and resources of others for maximal profit, benefit, and hoarding, while justifying and practicing denial of access and sharing of resources to said others. It is a system designed to and practices control, including enslavement and dependency of the other, so as to dictate and coerce the exploitation of the other and product of the other for the exclusive benefit of the conqueror, the colonizer. Conquest pathology, the driving impetus of white racism. So the white insanity is what we're looking at. And so when we look at the work that's out there, the white insanity is defined as psychopathic racial personality, a narcissistic people, narcissistic culture, Heru-Ka, responsible for disorder in the universe. European American delusional psychosis proclaims ownership of the world. And this is in practice right now. Conquest pathology, the compulsion to conquer and dominate every aspect of creation. And you get it. I'm going off topic a little bit, but you get it in really in nuanced kinds of ways. Whether if you're watching Star Trek, it's to do what? Conquer space. If you're watching Pirates of the Caribbean, it's to do what? Go and take something from somebody else. Right? If you're watching a what's the commercial? It's a bar. It's a food bar. Darn it, I want to. The name of it escapes me, but this is a young lady. She's off into somebody else's country looking for the herbs to go into this particular bar, but she's going to somebody else's space to take something for them. So the conquest pathology, the own and control. So negating the European American psychosis, the mental health challenge, the author Hickling says, the mental health challenge for African people around the world at this time is to negate the psychology of 500 years of racism and colonialism and create a blueprint for mental health in the African diaspora. The Dr. Clover Sims says, you know, Western hegemony over non-white people reflects a deformed philosophy of human existence and human essence, a deformed philosophy of human existence and human essence. And we need to challenge that. So what is the capacity of whiteness to deliver health care to African/Black people? So how do we address the white insanity? Noble says, in searching for the cause of Black mental illness, it is first necessary to liberate ourselves from the state of mental bondage. It is suggested can only be achieved at the point where we develop and become aware of our intrinsic African apperceptions. The implication of this is clear. The Black mental health professional must accept the challenge to seek out the causes of Black mental illness and define Black mental illness. In daring to make a prediction, I will conclude by saying if we accept the challenge, the search for a cure for Black mental illness will lead us to the position of requiring the eradication and metamorphosis of the fundamental premises upon which which white American society is based. So how do we decolonize African American healthcare? How do we decolonize this? And it's by challenge. So Dr. Hickling out of Jamaica, leading the decolonization of healthcare in Jamaica, does so through cultural therapy. And so with the patients in cultural therapy, one of the things that the patients, as the patients in a group session, is that they come together in group session and they deal with the European insanity that has been imposed upon them, and they actually critique that in a dialectical way. So in this dialectical chart, we have the European delusion at the top of the chart. There's a dividing line between, and in that delusion, here are the things that white people have said. At 1500 BC, there's a timeline there, 1500 to 2500 years, not BC, 1500 CE, current era, the delusion of discovery of America. Columbus discovered America. This is what is being taught, even though people are right here, right? It's like somebody discovering your house and then claiming it. So the delusion of discovery, and folks who are saying, say no, they were invaders. Under the banner of the white insanity, the delusion of ownership. In other words, Cortez and others who came here claim, I claim this land in the name of the Catholic Church. I claim this land in the name of the king. And the people said, what? These are thieves. As the invaders engaged in genocide, they attempted to justify the genocide by defining the people as things less than human beings, so we can actually go in and slaughter them. And so the folks in their right mind define these people as murderers. where the delusion honored slavery, the ultimate delusion, the people said, no, these people are plunderers. And so you can see the chart. I'm not going to go through every one of this, but there is the need and in order to claim one's health, to look at this white insanity, the European American delusion, confront that delusion and dispel with that delusion. And this is not just for Black people, this is for white people as well. And I'll talk more about that as I go forward. And then one of the things about this is, as we confront that, knowing that there is going to be pushback. So, decolonizing African-American healthcare, there's a process. And part of that process is a declaration of independence. In other words, for Black people to move forward in dealing with our healthcare, we must claim independence from the white, racist, colonial system that has actually done us no good and is doing us no good, and confronting white racism and white colonization. So in this Declaration of Independence, one of the things is clear: if white people were left to their own volition to effect an end to white racism and white colonizing of African people, it will not happen. For the last 150 years, white racism against and white colonization of African American Black people have not been abated in any significant way. From the foregoing, it is clear that white people do not have the capacity to end racism and colonization without opposition. So if left for them to do it, it's not going to happen. In this light, it is important for African American Black people to declare independence from white domination. That is, white racism and white colonization. It is imperative to declare authority and self-determination in addressing our health care. It is imperative that we declare white people incompetent and of having no intentions to realize African American health care. A declaration of independence in healthcare is an affirmation of intent to take control of our own healthcare destiny. It is to reclaim ourselves. It is an affirmation that we are better suited to do what white racists and white colonizers will never do and have never intended to do for us. In fact, history has shown that said racists and colonizers have never benefited the oppressed, the colonized, anywhere at any time. In other words, when we look at white colonization of Black people and non-white people anywhere in the world, they have never benefited the people that they have colonized. Never. And neither have they ever given it up without a fight. This declaration must come with action. Action that confronts white racism and white colonization, that is, the white insanity. It is to confront and neutralize the delusion and propaganda of white supremacy. Here, the European American delusion, a fiction, is called into question with opposing facts. In other words, facts over fiction. Reality versus delusion. And this is what Hickling did in this particular chart. And that is that to address this proclamation, because basically, when we look at the racism and colonization, the victims, the colonized, have been defined by white people as ill, as sick, as mental, as crazy. So I'm not going to go into a lot of the history, but in Hickling's book, he talks about, for example, in Jamaica, when the British came in and set up their system, healthcare system, that they filled their institutions with Black people that they deemed to be mentally ill. So that is, if you did not want to be dominated by white people, you were deemed to be mentally ill. So if you were fighting against oppression, you were deemed to be mentally ill. Well, that's the same thing that happened here in this country when Black people, for example, made efforts to escape enslavement. The folks who did so, who were recaptured, were deemed mentally ill. So if you don't want this white domination, then you must be ill. That's like, you know, the way our prisons are filled. You must be mentally ill. It is to confront the white race's presence and control of African Black health care, decolonize and neutralize representatives of racism colonization. It is to establish African Black leadership over the control of African Black healthcare, recruit, train, and elevate African Black healthcare providers. It is to establish a Black mental health paradigm grounded in the African Black historic cultural identity, grounded in the African philosophical worldview, grounded in the African moral idea and imperative. So, for example, so in the African ideal, the African moral ideal, the African ethic that exists, it existed in the African society, for example, goes back to one of our ancient civilizations, ancient Kemet, that most people call Egypt. And in ancient Kemet, can you imagine the greeting, the daily greeting was Ankh Uja Senet. It translates life, prosperity, health. This is the daily greeting. So when I see you, I am saying to you, Ankh Uja Senet. I am wishing upon you life, prosperity, and health. Also, in the society, the collective vocation was what is called do ma'at. And ma'at is the life force that is the representative of cosmic order and balance. We all are called to keep with cosmic order and balance. Do no harm to the environment. Do no harm to any other. There's a moral imperative there too: justice, truth, rightness. So that the admonishment was speak truth and do good. And so in the medical industry, and when we look at African society, the intent was not to exploit anyone's illness and injury, but to do what? Bring health, life, prosperity, and health to the person. It is to establish a Black agenda and ethic of Black healthcare. As one author writes, one tool that African Americans have to resist and perhaps to transform health-related maladaptions is to develop a social ethic that can reintroduce and appropriate positive strategy for living. This ethic must resist the psychological and spiritual debilitating effects of structured inequality. The struggle to create and institutionalize such an ethic challenges the tendency of mainstream society to serve the cultural aspirations of economic elites and at the expense of African Americans. He concludes, he says, there's a systemic inclination to resist a countervailing Black social ethic that tends to negate African American dependency on white supremacy. So I figured you would get this for a little bit. So there's something called anti-dialogical action. And so a part of racism and a part of colonization is anti-dialogical action. So I put this here because anti-dialogical action is like your television. So think of it like your television. You turn your television on, it's blaring, it's projecting to you, but it's not listening. There's nothing you could say to your TV that it will hear or it will honor or recognize. It doesn't see you. All right. And so in the dynamic of colonization and enslavement, anti-dialogical action is at work. All right. So there is so there's that dynamic that is work. It is to establish the criteria by which other people, including white people, can participate in the efficacy of Black healthcare. Under the white racist colonial system, it is the white oppressor instructing and overseeing how African Black people may participate in their own healthcare. The pathological dynamic is changed in the decolonial independence arrangement. So one of the things that we must take into consideration is that, all of us who are peers and engaging in healthcare are doing so within a colonial model, within a white racist dominated colonial model. And I'm not disparaging any of the good that we do, but even the good that we do based on the system that we're in is not going to yield the ultimate result that we want. Ending mental health, ending certain causes of mental health. So racism is the predominant cause of mental health in the Black community. I'm sure it is the predominant cause in every community, even white communities. Racism and capitalism, because it is driving people mad. So to white people, to the white community, there's a responsibility to come to grips and understand this information. So, for example, the writer Haberman, writes about this in his book, and he says that for the last 50 years of research that he looked at, that the medical institutions have not, should have made racism ethics a part of their curriculum, so that the people in these institutions can understand and work at doing away with racism. However, he says that it has been relegated to a second order priority, relegated to odd hours in formal curriculum. 10 years later, a survey of medical ethics education in US and Canada medical schools found that little has changed over the previous decade, that practicing physicians and medical students alike have voiced their concern that ethics curricula often fail to address the stage-specific needs of students. He goes on in his work to show, and he says this out of his research, that based on the foregoing information, there's no reason to assume that whites' knowledge of Black lives has substantially improved since the 1960s. And Black medical personnel, he says, are among those who have made this point over and over. So to hear that white knowledge of Black lives in the medical industry hasn't improved. But it's in general, but in the medical industry hasn't substantially improved since the 1960s. That's 60 years of no substantial change. So I'm saying that it even goes back to something further. I'm sorry. So in the book, Oppression, Social Determinant to Health, Elizabeth McGibbon says it is urgent to understand how oppression and health are closely connected to the root or structural causes of ill health, such as capitalism, globalization, colonialism, medicalization, and neoliberalism, which also should be put racism. That the key to tackling these structural forces is understanding and changing oppressive practices that cause ill health, thus reframing growing health inequities within the scope of moral responsibility and social change. The book provides a comprehensive overview of core ideas for investigating how oppression gets under the skin to perpetuate health inequities. So that when we look at and we are asking, why in the hell are our youth doing the things that they are doing? Our youth are doing what they're doing because they're conditioned to do what they are doing by way of medical industry, by way of other institutions of racism and colonization, iatrogenesis. It's created. You can make a lot of damn money sending people to prison. You can make a lot of money sending folks into states of ill health, iatrogenesis. Grant writes, a major underlying concern in global Black mental health is the lack of Black representation. Representation in research, both as investigator and participant, in the clinician's chair, on the clinical boards of directors, and among inpatient facilities, C-suite executives, is significantly lacking. The imbalance in representation indirectly perpetuates existing power imbalances and inequities, which result in reduced access to certain types of therapeutic interventions, over emphasis of pharmacological interventions, and incorrect diagnosis. Each of these factors create a huge systemic gap in wellness opportunities for communities that experience a unique set of oppressive stressors that negatively impact somatic and behavioral health. Colonialism and racism are violent impositions in the Black community, along with capitalism, is exploitive. It is designed. So when we ask the question, why haven't we gotten anywhere in the last 50 years? Why haven't we gotten anywhere? Police brutality and all these other things that are associated with it, it's the same. Nothing's changed. Why? Because as a colonial subject, we are victimized in everything. In terms of resources, are in the hands of the colonizer. Nothing is in the hands of the victim of colonization. And as we are pushing forward, we have whites who are pushing back. So in the book Protecting Whiteness, the author points out Protecting Whiteness presents three unique parts, focusing on the ideological reinforcement of white supremacy, the retrenchment of whiteness in American institutions, and white emotions, expressions, and movements. White lash is a collective and historical process made up of actions and reactions of whites attempting to dismantle any challenge to the racial status quo or any calls made by oppressed groups for equal rights and treatment. So that's one of the reasons that we got or you got a Donald Trump in office who actually ran on a racist agenda, who, folks equated with an Adolf Hitler. But when I asked, myself, how is it that such an overt racist could come into office? Well, it was easy. I recognize America under racism and colonialism has created many Hitlers. George Washington was a Hitler, an enslaver, a genocidist. Jefferson was a Hitler, an enslaver, a genocidist. The U.S. has created many Hitlers vis-a-vis in relationship to Black people. So white lash is one of the things that has been going on as Black people move and push for progress. There's always been a pushback. So, one of the things that we, that's become, talked about quite a bit is equity, diversity, and inclusion. Equity, everyone is entitled to the same access and treatment. Diversity, the workplace should reflect everyone. Inclusion, everyone should have a voice and be allowed to participate. So we talk a lot about this in peer, right? As we are trying to move towards equity, diversity, and inclusion. But one of the things that I find missing is this health, equity, white racism, and colonialism. As this book here, The Impacts of Racism and Bias on Black People Pursuing Careers in Science, Engineering, and Medicine, points out, health equity generally is defined as the assurance of the condition for optimal health for all people and must be present to eliminate health disparities. However, this definition defines health equity as happening within the context of white domination, which of course is an obvious oxymoron. Equity, diversity, and inclusion are proffered as remedies to the healthcare disparity between the white racist colonizer and the African Black colonized. However, there is no proffer to end the war for white supremacy or to end the white colonization of African Black people. So in other words, Black people are offered the opportunity to participate in the ongoing oppression and the ongoing white racism. So you can have equity, you can have diversity, and you can have inclusion. This proffer is the same proffer that was made to Africans on the continent of Africa as they were fighting for liberation against the white invaders in each of the societies. It was the proffer made in South Africa, in Algeria. So Frantz Fanon, the brilliant and prolific writing psychologist, recognized this and said that when challenged, the colonizer, the oppressor, makes an offer rather than relinquish control to the colonized, makes an offer to the colonized to participate. In other words, I'll share with you. But this equity, diversity, and inclusion is not a new thing. As a young lady mentioned yesterday, I attended a workshop and they gave me a good word, rebranding, because that's all it is. It is rebranding. So decolonizing includes, decolonization, and relinquish of domination. Colonization involves one group taking control of the land, resources, language, culture, and relationship of another group. Decolonization on the part of the decolonizer is the action of relinquishing control, returning and sharing of resources, acknowledging, recognizing, and in some instances, supporting the autonomy, self-reliance, independence, sovereignty, integrity, and separation of the former colonized. Decolonization is the cessation of attacks and hostility, the cessation and ending of white racism, which is actually a violent act, which is what? War. So it is a cessation of attacks and hostility, including propaganda against the former colonized in the pursuit of peaceful coexistence. Decolonized African American healthcare would look like self-determined healthcare, autonomy, self-reliance, resources. The model is a milieu, an extension of the African Black community of institutions, practitioners, medicine, ethic, culture, language that sees the African Black client, embraces him or her, that is safe, that collaborates in bringing about optimal health. So as this says, we are ending white racism and colonialism. And the author here, this is a excellent work to read. So if you're on board with the need to end white racism and colonization of Black people or any other people, it's an excellent work to read. It's a 600-page excellent work of the many works that the Dr. Amos Wilson has written. It's an anti-colonial work, Blueprint for Black Power. So affecting decolonization. To affect decolonization of African American healthcare is to bring the following conditions for African Americans into fruition: autonomy, self-determination, self-reliance, power sharing, resource sharing. Right now, we have none of it. So how do we talk healthcare for Black people when that healthcare is all controlled and defined by the very people who are colonizing us and defining, actually impediments to our healthcare? So Dr. Clover Sims says, the health of a people is an important measure of the viability of their culture. Health is also negatively affected by oppression and exploitation. More than this, the struggle for liberation, the people must seize control of their health as a requisite to transforming their subordinate status in society and the world. Better health improves the quality of life, and therefore health helps to mitigate the terrible effects of exploitation. Most importantly, however, better health frees the potential for positive change, for increasing the viability of a people. It's an excellent book to get, Cultural Hegemony and African American Development. This is a new book. Actually, it's not even on the shelf right now. It will be later this month by Dr. Frederick Hickling out of Jamaica, and says this book traces the historical post-colonial journey of 4 generations of Jamaican psychiatrists challenging the European colonial civilizing mission of psychiatric care. It details the It details the process of deinstitutionalizing patients with chronic mental illness using psychohistorographic cultural therapy, not only to express the express and reverse the stigma contributing to their marginalized status, but also to reconnect them to centuries-long history of oppression. The book demonstrates that psychological decolonization requires a seminal understanding of the complex mental interrelationship between slaves and slave owner. Further, the psychohistorographic model analyzes the antipodal dialectic history of descendants of Africans enslaved in the New World by British imperialists suffering from the European psychosis of white supremacy. This is a must-get book. So that if we are talking about helping peers, if we're talking about helping folks like me who come to drugs or who comes to mental challenges by way of racism, colonization, then you need to know what my condition is. You need to know what's behind it. If we're talking about dealing with Black people, as I agree with the, as I said at the beginning with the psychiatrist when I met and we talked, and he said, listen, I treat every Black person as though they're affected by racism. And that is the truth. None of us have been without trauma by way of racism. What are we striving for? We're looking for a decolonized world. And in that decolonized world, for example, on the side for African people is declaring our independence, asserting autonomy, establishing an African paradigm, restoring African Black health and well-being. And that would be what? To pre-American, pre-North American, because we've never had it here. That's the history. So we can't point to a time when we can say, oh, we had healthy communities on the slave plantation, or we were at just the greatest of health. We've never had optimum health. It has always been the reverse. For decolonizing white people, it means that white people must reconcile with white insanity. You must call into question this claim of owning the earth, of owning people, of owning nature, of owning everything in existence. It means reforming the white agenda. It means ending the quest for white supremacy, sharing the planet and resources, making restitution and reparations to those harmed. It cannot be a thing of Black people or any other group of oppressed people under white racism and colonialism moving to bring health to themselves while racism and colonialism continue. It's antithetical. So Black power, we are ending white racism and colonialism by the work that we're putting in. And we all have a role in that particular regard. So achieving coexistence should be an objective. And being diametrically opposite when we met, we clashed. However, that clash can end with European sovereignty. Nobody's saying that white people should not have sovereignty, self-reliance, renewed identity, and no racism. We're saying that African people, Black people should have African sovereignty, self-reliance, restored identity, and no oppression. That there should be a sharing of this planet, the planet resources and our existence on this planet. The goal is to create and establish total control of African-American healthcare into the hands of African-Americans, Black people. An example of decolonized African-American healthcare is the African Black client receiving care under the auspices of African Black power and control throughout the process. Walking in the door, Black doctors, Black medical ethic, Black whatever it is, and dealing in an environment that is healthy. With respect to Black-white healthcare relations, it is the collaboration of the two with whites contributing, not controlling or dictating. Neither are they imposing. So that Black circle we see as a model for Black health is the Black agenda of healthcare. Race first, resources, institutions, under Black administration, Black healthcare personnel, Black ethical healthcare in effect. Neither of which we have under colonialism, where colonialism is actively engaged in thwarting this. So I'll say thank you for staying in and hearing what it is that I have shared, and hopefully you found some value with it. So this is the presentation, a decolonizing African-American healthcare model and peer support.
Thank you. I'm going to stop your share screen so you can read through the chats there.
Oh, okay, cool.
There were just there were a couple of notes there, and open it up. If anybody has any comments, if you put your hand up, we can call on those.
Yes, institutional shift must depart. Thanks for sharing. The best thing I've seen in many years of attending Peer Apocalypse. Thank you for the workshop. I guess I'd have to go scroll up to see some of those that were, let me do that and try to get up. I am only a participant without audio. Oh, I can't hear. Can you send it again? I can't see it. I don't see any documents.
Yeah, I was able to resend those documents.
You were?
Yes.
Oh, okay, great. And I don't. Can you place it again? Okay. Could it be possible to get a list of the books? There are some you mentioned. Yeah, I actually in those documents sent a bibliography for those who might want a bibliography. I sent a definition of racism. And this is being recorded also, so that if you are able to view the recording again, you'll get the title of some of the books too. Machinations Reflect Denial of Behavioral Health Hustle. We should talk to institutional shift. Yes. Is anyone here familiar with the book I think, called the Iceman theory or Iceman inheritance. It suggests the reason Caucasians are at heart conquerors. Yeah, the book is called Iceman Inheritance. Darn, I forget the name, but I did read that particular book. It similar to what Diop talked about in terms of Diop's two cradle theory and the origin of white racism. Diop is much more comprehensive in that particular work. And I'm I'm open to folks calling me and dialoguing with me. Let me share that I am also the founder and director of the X-Racism Project. And so the X-Racism Project is an initiative towards ending racism. So I do lectures, I talk, and I teach, as well as organize around it. And if you're interested in doing so, I did put my information in the chat at the top of the chat. And if I can find it again, I get the right page, I will, am I still sharing?
No,
Oh,
no.
okay. So I need to,
Did you want to send your bibliography again?
yeah, I'm going to send copy, and this is my contact information. I put it in the chat right now, so that you're more than welcome to be in touch with me. And I just want to see if anyone else had questions. Book, Donald Marine, The Philosophers of Finnegan's Wake, Mentally Ill, Bad Usage, Not Moral or Scientific, Mad Lives Matter workshop approved by Hip Hop Congress 2015 on Peer Apocalypse website, Social Accountability Work Group, We Embrace Advocacy. This reminds me of a theory that the resistance of a group is incorporated into a dominant group so that the dominant group can continue to maintain power. Is anyone familiar with this theory? Yeah, well, neocolonialism is such, it speaks to that specifically as well. So if you look at neocolonialism in relationship to African efforts towards independence, towards revolutionary liberation movements in South and Central America, all have come under the auspices of neocolonialism by the colonial powers. So that would be one thing. Proper advocacy. Welcome. See if there's any other. Well, if anyone wants to raise their hand and ask a question or comment, you're more than welcome to it. Feedback is fine. Criticism, whatever. I love to hear just the dialogue, whether you got anything out of this. And it's a work in progress. But while I'm waiting, just understand that when I shared with folks here about the conditions that we are in, I recognize that as a person of African descent, that I'm a person who is colonized and dominated by white racists in this country, and that when we talk about achieving optimal health, of course, this is always going to be there in front of my face. Like, how is that going to be when this wall is there, preventing that to occur? And as I, shared document research information of over 150 years, nothing has changed. And the reason it has not changed is because not that it can't be changed, it is not changed for the very reason that folks are exploiting it. It's like the prison industrial complex as well. So the medical industrial complex feeds off of Black misery.
Go ahead, Dallas.
I just wanted to say thank you for all the information for your presentation.
Thank you. I appreciate you. And thanks for your acknowledgement. I truly appreciate you.
Charity?
Yeah. Hi. This seminar is definitely the best one that I've been to at Peer Apocalypse. A lot of the ideas that you presented today, are things that I really haven't heard of. Things that I wouldn't have thought of. So I I just appreciate so much your wealth of knowledge and bringing that here today and sharing that with us. I really look forward to digging in and understanding some more of the terminologies that you use today, and reading some of those books that you presented as well. So I just really want to thank you for that.
Charity, I appreciate you for attending, and and your acknowledgement. And I encourage you, and that's one of the reasons I provided the information. I know for some it's new. It may be more than just a gloss, but more in-depth information. And I didn't want to just simply cite books without showing you, the references. Here is where you can go and get more information, because I think as we are as peer, what I hear, one of the things that I hear as a theme and consistent is that we're all change agents, and that we're all engaged in helping in one way or the other. And so in that particular regard, sharing the information that I did was, here are resources, to help you learn this, to help you get an understanding of what this is and how you can, engage. Because decolonization is one of the things that, and decolonizing healthcare is something that we should be talking about. It's not just that Black healthcare is colonized, white healthcare is colonized. So that one of the quotes that I read earlier, with as the writer pointed out, with the U.S. being 49th in expected life expectancy, based on the healthcare industry, not based on anything else, not based on, we using too many drugs, that people are overdosing, or, certain things, people are getting greater disease. It is what the healthcare industry itself is doing in terms of exploiting people over diagnosis, over medication, medication, just simply exploiting monetarily. So you are colonized, because I realized it myself, white people in this country are colonized, not to the degree that Black people are, but you are. So the healthcare industry right now, as you find yourself paying through the nose, like we find ourselves paying through the nose, isn't of your own making. It is because of the institutions that exist to exploit.
Yeah, thank you.
You're welcome.
I had a couple additional thoughts. Would it be okay if I shared them?
Please.
Yeah, something that kind of came to my mind was sometimes people, like oppressed groups, will take in for themselves the ideas and the culture of the dominant group. So I'm thinking, for example, just communities that were oppressed under Trump administration. Some of those community members supported the administration, right? So you were talking about creating this healthcare system where it was kind of run by Black people, so that there was more equity of care. And I guess what I'm curious about is how that movement would begin, in consideration with like this knowledge. I mean, this feels so new for me, and I'm sure it's more it's easier for people that are a part of these oppressed groups to kind of understand what's going on, maybe. But I guess what I'm saying is, like, what do you think about that? People kind of becoming incorporated into the dominant culture, and how they can kind of free themselves from the structure, because I think a lot of people may not even recognize, in some cases, their own oppression.
Yeah. Well, I appreciate your question. To the first part of it, I mean, in terms of people taking on a certain type of mentality, bear in mind that a part of colonialism and racism is to indoctrinate people to think a certain way and to act a certain way. So I spoke about Dr. Wade Nobles, who talked about the Black healthcare practitioners in the Black community actually operating under a white, if you will, a caricaturized white mind. And so, I mean, a lot of, masses of Black people think that we can find salvation in this system. this system that is designed to exploit everyone, but to a greater degree, Black people who are oppressed within the system, or greater, excuse me, oppressed to a greater degree. So yeah, so the Dr. Nana Asetkar Anu defines this as super Stockholm syndrome. So you have Stockholm syndrome, of course, where the victim is it comes to identify and sympathize and empathize with the victimizer. Super Stockholm syndrome she defines as where a race of people come to empathize and sympathize with their victimizer. But this is based on what the victimizer has done to the victimized population. And then where I talked about Black people creating healthcare, it's important around identity and culture. People, we all have our extensions of given culture. And so our cultural identity is Dr. Diop talks about the perfect cultural identity that is made up of history, language, and philosophy, and psychology. That it is important that Black people reconstruct our identity. I mean, for example, one of the things that we constantly experience every day in this society is what I call the Kunta Kinte Toby syndrome. So we are seeking to re-identify who we are in this country. Racist oppression has been constantly at work to sever us from our identity. So for example, I mean, this terms that I just detest hearing, because, and I'm saying this, and let me put it in context, because I don't hear people saying African people. See, I'm African by race, I'm African American by ethnicity. I'm not BIPOC. I am not a people of color. I am not a minority. They don't define me in any cultural context. So for example, let me give you a sense of the people of color thing that, it's like in this racist dynamic. If I go to Mexico, or I don't even have to go to Mexico. In Mexico, there are Black people in Mexico who are treated like shit by light-skinned, white-skinned Mexicans. And those Mexicans migrate here and they're called people of color. And they're put in a pot with me when we're not the same. If I go to India with its racist caste system, which is one of the oldest documented, areas of white racism going, we can document it at 3,500 BC, 1,500, not 3,500 BC, 3,500 years old, 1,500 BC, where the Aryans invaded the Dravidian and Harappan societies, the Black societies, they established racism. However, in India, there are Black folks, my complexion, darker, the known as the Dalit, who are treated as and called the untouchable. And the caste system there, among Indians, particularly among Hindus, treats darker skinned people like garbage. And those same folks can come here and be called people of color. Really? And Asians, and I'm not saying every Asian, but in Asian countries, dark-skinned Black people who live there are treated like garbage. But the same Asian can come here and be called a people of color. And we see it all the time. So they're able to come here, they're able to get resources based on your person of color, and there's resources set aside for people of color to excel. They get what we don't get. So, I don't, so I say to people, do not lump me in. I'm not BIPOC. You know what I mean? It's these things where in the part of racism is never to define us as a people. We're African people. And that's what we should be referred to as, by my way of culture. I mean, yeah, I get that we also call ourselves Black people, but I'm saying my identity is as an African. BIPOC, I don't know what that is. Minority, I won't go into that, but there was another part to your question in terms of Black folks creating moving towards Black self-reliance and Black autonomy in the field of health, it's important that Black folks are able to receive care from Black people. It's important that white people are able to receive care from white people, that Asians are, because each group has its nuance, each group has its particular milieu that's distinguished, but it does not make or mean that because you have your particular culture that is necessarily antithetical or should be antagonistic to the other. It doesn't. Not only that, I also said in this presentation that in what we are seeking to do is create the environment where you can share. Because we already have that going on. One of the things that I didn't have opportunity to do as much as I wanted was to show models that are created. So Jamaica with Dr. Hickling has one of the best models that is going right now, but there are white doctors that are participating in that. And on the continent of Africa, there are under the auspices of Black healthcare, there are white doctors and non-white doctors, Asians, and there are other non-African people, I'm talking about in terms of race, that are participating there as well. But what we're talking about is doing away with the system of oppression and exploitation. Anyone else? Amalia, thank you. Would there be concerns of segregation that reinforce ideas of difference in the no, because the whole point is, I mean, difference, people being in separate communities is not in and of itself a indication of segregation. I mean, all over the world, people have communities, right? You know, without segregation. So no, it's not even about that. Segregation literally has to do with, when you're talking about segregating, having your community and also at the same time imposing on another community. Separation is not the same thing as segregation. Supremacy also is the same thing. It's an imposition. So nothing here in terms of having controlling your life. In other words, what we're talking about is controlling your life and your destiny. Black people in this country do not control our lives and our destiny. Under oppression, under colonization, no one does. And it's not only Black people that are oppressed. You know, Native Americans are oppressed here, right? Hispanics are oppressed here. There are folks who are oppressed all around the world under colonialism and under racism. And what it means is that by the definition that I gave of colonialism has to do with your being divorced of resources. So colonialism is the domination and control of another people in all spheres of existence. In other words, someone else controls the resources that govern your life. They control, you know, whatever. So you're being manipulated for that. But thanks for the question. So are we coming to an end, Jenny?
Yes,
Okay.
we are. Yeah, we're a little over time. Thank you, everybody, for staying and for participating. Have a good rest of the conference. Thank you, Mr. Arnell.
You're welcome. Thank you. I truly appreciate you. Have a perfect day, everyone. Goodbye.